Hi everybody, today we talk about very important disease. But first we watched his video and we will return again to comment with dear guests. Anemia of chronic disease. What's anemia of chronic disease? It's a shape of anemia that occurs in patient who suffers from chronic disease or immune activation. It also called anemia of inflammation. Let me give you a little bit historical background about disease. In 1836 Richard first observed that anemia was a complication of renal failure. Christison further described renal anemia. In 1977 Mackay purified and identified erythropoietin. Now we talk about mechanisms of the disease. If you get an infection, it causes inflammation and invasion of microorganisms stimulate production of interleukin-1, interleukin-6, and cytokines, a protein used for signaling between immune cells and activates them. Then, interleukin-6 stimulate the liver to produce hepcidin, a hormone, which inhibits duodenal absorption of iron. At the same time, when red blood cell is old or becomes damaged, it enter the spleen and then these splenic macrophage will then engulf this damaged or blood cell and digest it. Actually, macrophage will digest it into smaller and smaller material. One of each is iron. Iron then can be released back into circulation and been recycled for erythropoiesis in the bone marrow. And evil hepcidin come again and block ferroportin, which allows that iron to be transported out of those cells and into the bloodstream. So the iron not released, then T cell produce interferon Y that inhabit kidney to produce erythropoietin. A hormone controls the formation of red blood cells so bone marrow not produce erythropoiesis. Look to this figure to more understand.
شكلك فاهم يا نص.
Summarize. In case of anemia of chronic disease, hepcidin released in response to any inflammatory condition such as infection, cancer and also autoimmune disease. All of this cytokines cause an increase in hepcidin production. Hepcidin decrease absorption and recycling of iron. Decrease in iron followed by decrease in hemoglobin followed by anemia. But why all of this happen? In any condition such as infection, bacteria thrive off iron and they used it as nutrient to grow. So body keeps away the iron so that the bacteria can't use it to grow. Now let's talk about some of differences between anemia of chronic disease and iron deficiency anemia. In both of them, the serum concentration of iron and transferrin saturation, or the percentage of total binding site, are reduced. In case of iron deficiency anemia, the transferrin increased, the cytokines level is normal, and ferritin, which is a marker of iron storage, reduced. Unlike anemia of chronic disease, the transferrin reduced, cytokines level increased, and ferritin increased. Well, how can I heal from this disease? Before the initiation of therapy, we should know accurate diagnosis of the disease, whether it anemia of chronic disease or anemia of chronic disease with truly iron deficiency. By measuring the percentage of ferritin in plasma, it helps us to determine the correct therapy for patient. This figure supported what I say. The therapy can't be oral iron, that can be harmful more than useful, but sometimes it used in case of anemia of chronic disease with truly iron deficiency. Also, we can use a blood transfusion or erythropoietin as a therapy, but we haven't the full study if this therapy had side effect or not. The ideal treatment is treatment of underlying disease. We're back again. I see from your interactions that I am a good teacher. Haha, I'm joking. Alright, we'll start the discussion. Mr. William, to what do you think the researcher contribute in science field?
The researcher opened a new research area to study chronic diseases and understand the happening of damage behind these diseases and how to treat more effectively.
I had example for what just say, the effect of erythropoietin therapy on tumor cells receptors and how iron therapy increases the risk to the body in this case.
Miss Hannah, talk a little about conclusion of this research.
Okay, this research opens our knowledge and understanding of the anemia that is the second most current after anemia caused by iron deficiency.
Do you agree with me? The research highlight the physiology of this disease, which mark it and the etiology of therapy.
You are right, and also, this research was associated with a reduction in mortality rates for chronic anemia patients and the opening of a new mechanism for understanding the treat.
Finally, I hope you enjoy with us and wait us for next time you had. Nadir Saifuldin from the Truth News Channel. Bye.